mics off for the panelists until you guys speak.
Good morning, and thank you for joining us for this keynote closing event to the Registered Nurses Association of Ontario's annual general meeting. We had a tremendous, remarkable, and engaging meeting, and we're thankful for you for spending time with us today. The first order of business is for us to acknowledge the Indigenous peoples of all the lands that we're on today. We recognize that the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of RNAO is located on the traditional and unceded territory of the Huron-Wendat, the Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Bell Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of RNAO's AGM are located in other traditional lands across Ontario. Today, this land is still the home to many First Nations, Inuit, and Métis peoples from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and the Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. Thank you. We now call on our esteemed CEO of RNAO, Dr. Doris Greenspan. Doris.
Thank you so very much, Madam President, Dr. Holloway, colleagues, past President, Dr. Morgan. Hey, Morgan, okay, now you need to go and get that. And then, dear colleagues, all of you, quite remarkable to see 84 people, and it's growing, the numbers on a Saturday morning after all these days of giving of yourself to the association and to have you here. Thank you for joining us. You are in for a treat, so it's time well spent. We are going to now share the agenda with you for this closing keynote panel. And we will explain to you how the panel will go. We will first have opening remarks from each panelist of about 3 to 5 minutes. And if they go to 5.5, that's fine. It's up to them and they have that flexibility. I have no idea what they're going to say. And there is no right or wrong answer. It's what they believe nursing is undergoing and how it will come out of this pandemic, and some tips, hopefully, of what we need to do. Following the opening remarks of the panelists, and I will briefly introduce them in a minute, we will have an idea cloud that will be led by Raul Pinto, and he will give instructions for that. In that idea cloud, what we will want is just one word that captures what you heard in the panel. One word about what you think, your feelings, one. Although the cloud allows for 3, so here you go. But Raul will tell you about that. Right after the cloud, we will have comments or questions or reflections, whatever you, the participants, want from participants. We are going to take about 10, maybe 12, depending on the time, participants, and we will take you first come, first serve, one at a time, to make that reflection, that question, or that comment. And Ifra Ali and Marian Zich will moderate that part. We are not going to be answering to your questions. If you ask one question, we will just, all of you will reflect, the 10 of you or 12 of you will do that. And then we will ask our powerful panel to give closing remarks. And we will do it in the reverse order. We will do it in the reverse order, starting with Dr. Vanessa Burkowski, and then going to the other panelists, and you will see the order. It will be completely in reverse of what we started, ending with Ola, who is the student graduating soon, to tell us how did we leave her for the future. So that's our keynote panel. I think we are in for a treat. I will introduce you in a second in the order of the speakers, and then we will ask Elder Perry to close our AGM with his blessing, his reflections, and you are in again, I can tell you, for another treat. So, the word of why these colleagues were chosen was one. It's called courage. So if you want to know all their bios, you please go to the website. In the website, you will have the bios under the AGM portal. So we will start with Ola, which is, Ola, courage to stand your own in the midst of differing opinions. And I have seen that with you in so many, 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 many occasions. It bodes well for your future leadership that you have your own take on things. And that's why you are starting the panel, but you are also ending the panel. And then we have Carla. And you may have heard Carla before. Carla is an internationally educated student that came from Philippines, and she sweated on and on pushing. She became an RPN, and she did it all and still was waiting to be able to be working. And she had the courage and the stamina to do that. And Carla, just so you know, the good news is working now. And then after Carla, you will have Amek. And Amek, we chose Amek and his courage for speaking out. Amek not only works in public health, Amek also has his own radio show, and my golly, he speaks out, and he comes after us to speak out. And you haven't seen all about Amek yet, I have a feeling, but Amek also had the courage to go to Ukraine in the mission of Val Repka with CIMAT that was organized by CIMAT and RNAO, and that requires courage, Amek. It's taking the words to have the courage to put, a couple of things in the luggage or in the backpack and go and sleep on the floor and all the rest that you underwent. After Amek, we have my guru and mentor in anything to do with indigenous knowledge and indigenous learnings. And that's, of course, Maykat. And you have seen Maykat several times through these many years. And Maykat has the courage to speak truth to power related to indigenous health. Maykat has the courage and the passion and the commitment to work with communities, to work with substance use, to work with adolescents that have gone through tremendous trauma. And May, all our respect to you. From May, we are going to go to Madame Morgan Offord. And you have heard me say before that Madame Offord moved, and I already call her doctor, so she may as well start that PhD soon, so it doesn't embarrass me. So she moved to long-term care in the midst of the biggest crisis in long-term care during the pandemic. You heard us say that during these last days, that she had a very secure position, and yet she chose to move to long-term care and is leading a fantastic leadership role there. From Morgan, we will move to Dr. Holloway. Dr. Holloway has the courage to also stand her own. Dr. Holloway has the courage to follow her thoughts, her heart, and her vision on how to make the tremendous and complex tragedy of systemic racism move forward. And she will be the right president. We always have said it, Vanessa and Morgan, the right president at the right time to move RNAO forward alongside with the Black Nurses Task Force, alongside with the interest group, and most importantly, alongside with their own heart and mind. And we will learn, I know, hugely from her. And then, of course, you can see Dr. Vanessa Borkowski. And Vanessa is courage personified in her life and in her work. You may remember, may I say, that Vanessa spoke truth to power at one point, and I'm not going to go into details, but you can Google, and lost her job for speaking about that. And Vanessa has led her entire career from beginning to now with courage, with intelligence, with wiseness, and Vanessa, we love you. So you are in for a treat, and we will start now with Ola. And Ola will be the first giving her remarks for like 3 to 5 minutes. And if you can, Ifra, at around 3 minutes, just point 2 more minutes, and then or I can do that. I will do this. I will do this when you, except I'm terrible with time. I think we will let Ifra do that. Ifra, you go for it. At 3 minutes, just show, and then again at a minute. Go for it, Ola. All yours.
Thank you so much, everyone, for joining. And I'm really honored to be the only nursing student on this panel. It's really been an honor to be able to speak about the future of nursing. And today we'll be talking about how nursing will recover post-pandemic and what our profession will look like. And today I'm speaking from a perspective of a nursing student. And when I look at the nursing profession and what I want our future to look like, 2 things come to mind: retaining the experienced nurses and investing in us who are the future of nurses. Right now, I work as an extern in the emergency department at Mackenzie Health, and it's really been humbling to see how much nurses sacrifice and how much they support each other just to ensure that they show up to work and they care for patients. But at the same time, I can see how exhausted they are and how they feel excluded from decision making. So one thing I would like to see is nurses being included in decision making. They have to be listened to, and whatever opinions they have has to be incorporated in policies, because that is how we'll be able to retain nurses. And again, it really saddens my heart that when I speak to nurses or my preceptor, or those who have been able to build beautiful working relationships with, and they tell me that they plan to relocate or they just want to, they're tired. What I ask them is, who will teach me when you leave? Who will I learn from? Who will hold my hand as I grow in the nursing profession, right? If I'm interested in advocacy and social justice, who will be my role model? Who will be my idol? So this is why it is very important to retain nurses. And this is what I would like to see. This is what I want our nursing profession to look like. And secondly is investing in us. And I call us the leaders of the nursing profession. I will soon be a nurse and I will be a novice nurse. Now, this goes back to retaining the nurses. We need to retain those educators. And that is one way of investing in us, who are the future of nurses. And also we need more programs like the Nurse Graduate Guarantee Program or scholarships, just to actually retain nursing students in the program as well. And again, we need our flexibility with clinical placements. Nursing students have really been resilient in the face of the pandemic. In the face of pandemic, we've had to lose clinical placements, but at the same time, we've really found other ways to learn. So there has to be more investment in several ways nursing students can learn. In the past 2 years, I've really been learning and unlearning and building connections. And I really think nursing is not just a profession, it's a lifelong commitment and learning. That is what we do when we decide to choose nursing as a career. And for me, it would really be heartbreaking that in 5 years, I don't have that passion anymore. It will really be heartbreaking that in 2 years, I say, I'm tired, I'm exhausted. I don't want that to happen because I really do have passion for nursing. So I hope to see a future whereby our nurses can be retained and also there should be more investment towards us. Thank you very much.
Thank you, Ola, and so articulate as always, Ola. Thank you. So now we will move to Carla Ducasi. Carla. Your mic, Carla.
Good morning. Thank you so much for having me today. I am Carla Ducusin, and I am an internationally educated nurse from the Philippines. I have recently entered the workforce and I have been working for more than a month now, so I am fairly new. Moving on, the nursing profession has faced so many adversities over the years. The staffing shortage is one of those, and this has intensified during the pandemic. Because of these, many nurses have worked long hours, they have taken up extra shift, and they have taken more patients than they would normally have. These nurses have encountered these situations on a daily basis, and this has put a toll on their mental health, which led to low job satisfaction. During the COVID pandemic, we have seen so many nurses who have left the field, senior nurses who have retired early, and there have been so many nurses who have taken a step back from the profession and left the job entirely. I have spoken to so many nurses before I started working, and they have told me that, Carla, if there is a job out there that can pay the bills and it's not as taxing as nursing, I would take it in a heartbeat. As far as I know, nursing is not for everyone. Nursing is the nursing profession is for those people who are very passionate about helping other people who are in need and who would want, and these people would want to make a difference in the world. I feel disheartened that nurses would come to a point that they want to leave the profession that they used to love and worked hard for because of what's going on is too much. Not only that the shortage has affected the workforce, it has also brought detrimental effect on patient outcome and patient mortality. No nurse want to put patients in harm's way. These people who deliver care are constantly depressed, stressed, tired, and sleepless, and this puts patients at risk. Nurses and patients do not deserve to be placed in situations like that. I am fearful for what will happen once the pandemic has passed. I am hopeful, though, that since many advocates have been speaking out, this issue will be addressed. Organizations like RNAO had been advocating for nurses, have been advocating for internationally educated nurses like me. I hope that in the future, the government would address this and find ways to retain nurses in the field, entice nurses to come back to the field and support internationally educated nurses. There's 26,000 internationally educated nurses waiting for their licenses. 14,000 of those are RNs, and imagine how much manpower that is. So I really hope that these people get supported. That way, nurses will be happy, nurses will feel valued and appreciated. Patients will get the care that they truly deserve. Thank you so much.
Thank you so much, Carla. And we will move now to Amek Singh. Amek, take it on.
Thank you, Dr. Ors. Nursing is in a state now where we are hurt. We have been in our survival mode, if you will, putting all our efforts and energies towards the patients and the clients that we're seeing in the community, the hospital setting, public health. We're running thin. And yes, it's good to take stock. Yes, it's good to take reflection of what can we do better. We support one another when we can. We try to keep the social harmony going with the glue of humor and chocolate and coffee, if you will. But at some point, the big changes that we need to see in the profession is the same thing that we are asked of us as a professional as we interact with clients and patients, which is to be heard and to be felt like whatever we're saying is understood. by the decision makers, and the decision makers reflect the community and the patient population that they're serving. So as clinicians, as nurses, as we're growing in our field, it is up to us to ask our accountability from our leadership, to ask for formal leadership and pathways for nurses to progress and take the stance of leadership that they can in a formal capacity, because we're already doing it in an informal capacity, but to cement that by nurses being led by nurses in institutional settings, in community settings, and in decision-making settings. That is what we need right now. And I think that the way to bring change is to engage, whether it's your union elections, whether it's representation on different boards in your workplace, or in the community at large, and make the populace at large, the big Ontario sphere at large, Canadians at large, understand the challenging and work environments that nurses have. Because oftentimes when it's aha moments or something quite visceral, where it's lack of care outcomes or staffing shortages, those are understood, but the systemic reasons behind those aren't. A lot of the colleagues that have spoken before me have touched on it. Ones that are to enter the field have touched on it. And that is a challenge that we're facing right now, is we're not getting the formal representation that we need in leadership forums in different spheres of work. And that is the best way to retain nurses. If they're nurses, leading nurses, and guiding nurses through their journey throughout this very lovely profession and a calling, if you will, that is what we need right now. And it is in our hands. We have the control to make decision making. It's sort of like when we talk to a patient after they've had an adverse health challenge. We build them up and say, this is the capacity you have, take back the control. And we need to start taking back the control that we have as self-regulating professionals in the workplace, and have our challenges addressed by nurses together.
Thank you, Amik. And now we will move to NP Maycat. May, please.
Good morning, everyone. So I work in the remote northern communities. If you look at Ontario, we are 49 First Nations, 50,000 Ojibwe Cree, but we cover 2/3 of the landmass of Ontario. So if anyone ever wants to see beautiful lakes, waters, and eat fish, this is where you come to work. One of the things about our territory is we probably have the poorest health status in anywhere in the province, with our disease rates and our mental health conditions that have been going on historically. Part of that is we've been working in a medical model with in a colonial system that's not ours. It culturally doesn't belong and was never created for us. So during the pandemic, I'm on an expert pandemic team. We have had to pull on public health that's well known, but we've also had to realize that inherent in our culture and our knowledge is we have been through pandemics before, and we've done very well in protecting our people just by working very closely together. We only have one resident regulated health professional in our communities, and that's nurses. We would love to have more nurse practitioners because the scope of practice matters. When you're in a community and you have to provide a treatment, you can't go all the time when you're out of scope to call a physician. So during pandemic times, we realized this inherent knowledge in our culture is going to get us into being able to handle post-pandemic recovery. We've appreciated every nurse that has come to help us, including those who've rolled out the vaccine. We are very well vaccinated in most of our communities, and that saved us as well. What really suffered was our mental health and substance use conditions. We've had to create innovations. And one of the innovations that we created is a 24/7 crisis line known as NAN Hope. NAN Hope is unique. We want to continue that. This program has actually saved 170 people from suicide, and we've tracked that. We call them live rescues, but we have mapped out for every community where the caregivers are so that they can connect with that individual so that they don't take their life. I'm an end of career nurse now. It's nice to see some young people up and coming, but our nurses were bedside nurses. We were very relational and not very technical. And if you ever worked with an older nurse, you'll know that. But we bring to the profession a skill set that's quite unique in how we work with our communities. Our communities expect the relational types of behaviors from nurses. Get to know us, get to know some of our language, say a few of the words, ask us in the language, where the pain is, listen to the stories, and that will help get us through the pandemic. What we don't want are cultural clashes with any of the new nurses that come into our communities, because we want to embrace you as a profession. We want to embrace you as people. We can learn from your culture as well. We can learn from your unique experiences working with technology. But what we want from nurses are someone who knows how to assess advanced practice. And that assessment takes a long time because you're working in a cross-cultural language barrier. Involving family is probably one of the first ways to get through Northern nursing. We also work very closely with community-based workers. We call our a system that we're looking at that will integrate public health with culture is we call it Mino Anukiwan. Mino Anukiwan means working differently with your community. And we have learned that during the pandemic, our pandemic teams from our communities were the strongest allies and helpers that we had in our community. And as nurses, we needed to rely on them. They went door to door to do the testing, to do the swab so that we could actually identify COVID-19 infections and be able to contain outbreaks. The system is an Alaska system. It's actually called NUCA. And if you ever look up NUCA, you'll find a pretty exciting health service delivery model. So Miigwech, thank you. And I can't wait for the rest of the speakers.
Miigwech May, thank you very much. And we will move now to Dr. Morgan offered to be.
It's nowhere close to being a doctor, but thank you
I
very
am
much,
not
Doris.
sure that Corey or Grayson will want to hear that today.
Probably not right now, but who knows, maybe someday. So thank you so much for asking me to be on this panel. As Doris said earlier, I work as a director of care in a long-term care home in London, the biggest long-term care home in our city. And I transitioned to work in that role in November of 2020. So after the first wave of the pandemic, but definitely before the second wave and before some of the ongoing significant outbreaks in long-term care. I really love my role in long-term care. I think that it's a very rewarding role for the PSWs, the RPNs, the RNs, and everyone that works there. I know long-term care has the kind of reputation of being somewhere that people go when they can't get a job somewhere else. I would say for me, that's not the case. I worked as an RN in the emergency department. I worked in the hospital. I worked in primary care. I chose to be in long-term care because I think it really is a rewarding place to work and a place where nurses and nursing really can make a difference to help the residents that call long-term care live their best lives as they transition towards end of life. So I really love it in long-term care and just want to put out my plug for nurses to consider long-term care as a career choice, not as a fallback plan. I think as we move through from pandemic to endemic with COVID-19, there's a lot of recovery that needs to happen for nursing. We know it's been really difficult for nurses. I know that nurses have worked very long hours, short-staffed, and have been asked to do things that normally they wouldn't. They have been the support for residents, for patients when their families couldn't be there. They have been asked to take on a monumental burden to provide that support to people when they themselves also needed support. But I think that that's one of the really valuable pieces of being a nurse, is that we are able to fulfill that role. I'm very thankful that families and visitors are able to be back in to provide that emotional support. But I know that it has been exhausting. I also have worked very long hours, have worked as a manager, have worked shifts on the floor so that we could provide the essential care to our residents. I think one of the things that will help us to transition out of this kind of state of crisis, there are lots of things that we need other people to support with. We need the government support so that we can increase enrollment in undergraduate nursing programs. We need to increase enrollment in bridging programs. We need a way to get more nurses. We have an increase in people leaving the profession, which means we need to bring more people into the profession. Retention is also really important, because if we're bringing in an abundance of new nurses and new people to nursing, we need those mentors there. And I think it's really important that we focus on mentorship programs and being able to support new nurses to be successful in the profession. It's really difficult to transition to practice. It was difficult to transition from student to practice 12 years ago. I can only imagine how difficult it is now for students who have really had a lot of their placements and a lot of their education interrupted. But what I think is really important for the nurses who are here and working is to be the nurse that they would want to care for them, and to be the nurse that they would want to work with, to be that support person and to work together. I know there's lots of negativity. I think we have an obligation as professionals not only to share the difficult things that are happening, but also to talk about the positives of being a nurse. If we only talk about all of the terrible things that happen to us as nurses, it's not going to help us come out from this. It's not going to help to recruit new people to become nurses. And I think we don't want to minimize the things that should change and the things that are negative. It's good to talk about those things and to talk about the challenges from a perspective of advocating for improvement. But it's also important to talk about what does go well. Where are the good places to work? What is it that we can do as professionals to support each other, to support the health of nurses, to support the health of Ontarians, so that we can help to build a better healthcare system? And I know that there's a lot on social media that's designed to be negative, but I think we really do need to focus on some of the positives as well, because there still are a lot. Like we just heard from May about a really amazing and incredible program and lives that they saved. Those are the things that also need to be celebrated, to be talked about, so that people can see the positivity and the opportunity to make a difference in people's lives and to save people's lives. I also would say, kind of building on what Emmy was talking about, I'm so proud of the nurses who have run for elected office, whether it's running for municipal, provincial, federal election, whether they got elected or not, just standing up and saying, I'm a nurse and I want to make a difference on this larger level, will help us to get more nurses at the decision-making tables. We'll have that nursing voice, and as a part of the nursing voice, also the patient, resident, client voice at the table, at the decision-making table. And I think that that's also something that is really important. So I see Doris giving me the time signal, so I'll wrap it up there. But I'm very excited for the future of nursing.
I think that that's the Doris endemic that got into you. I mean, because this woman is always so succinct and on time. Thank you for the thoughts, Morgan. Very, very encouraging and also in depth. Thank you very much. So we are moving from Morgan now to Dr. Holloway. I know you don't need to do another PhD, please, enough with one. I mean, some of us at one point thought we will do a second, but no, right? No. Okay, go for it. Take it.
So thank you, Doris, and amazing points, heartfelt points from those who have spoken already. I am an internationally educated nurse, even though it was long ago. And I most recently practiced in public health and retired from full-time work. And during the days of public health, much of the themes that we've heard already, those of mental health concerns, the overwork, the frustration, that was also experienced too in public health. And reaching out to families in what we would call the hospital without walls, where we have no control, but those clients, they are so dependent on nurses being there to give them the correct information that they need. And nurses hearing the stories about how families who are challenged by workplaces where they can't get sick time off, these things that are controlled by the decisions that our government makes, and hearing that certainly wears it down. My experience over the years has been in a number of settings, and I believe it's important for all nurses to understand the full scope of nursing in all the different places, from those who are in research, management, practice, community, technology. So my perspective is that we have a great future ahead. We have so many opportunities, and we can create what we want going forward. There are some things that within our control, without legislation, that we can do, and we will do. We can speak positively to each other. We can build connections. We can build our own community up so that it's strong. But in the midst of all the pandemic and the challenges, we know we've had the Black Nurses Task Force report that identifies the challenges about anti-Black racism. And we know there's so much more anti-racism at all levels that occurs. And this report can lead the way because we need a zero tolerance. But we know how this has affected those who are coming along, those emerging leaders. And we need everyone. We need the internationally educated nurses that are there waiting in the wings. So we need everyone. We need to appreciate everyone. We also need to acknowledge diverse perspectives. And with all the loss, people have lost family members. There's been chronic illness. There's long COVID. And many of our members and many of the nursing profession have a strong belief in the need for spirituality. And we also take that from our Indigenous sisters and brothers, that spirituality is so important in how we can cope with what's going forward. So I want to see that even though we have technology such as social media to help spread information, I would like to see us build connections where we can have a proper conversation, where we can be supportive to each other, where we can allow learning to occur, and where we can help each other to move forward. So I'm very positive, and I am going to do all I can to bring out that diversity in nursing, help everyone to move forward together. Thank you.
Thank you very much, Claudette. And now is Dr. Vanessa Burkowski for the final words for this round of the panel.
Thank you. Can you hear me?
Yes.
It's a blessing to be on this panel with all of you today. Thank you very much to all of you and to RNAO for inviting me. I always feel so privileged to be in your company. when I thought about the question that Doris has posed to this panel, what will nursing look like in recovery post-pandemic, and what's our profession going to look like? I actually looked at the word recovery, and there's two primary meanings for recovery. The first is return to normal state, and the second is to find or regain possession of something. When I think about returning to normal state, I think about many times that RNAO has put forward some of the important issues that I think were further elucidated during the pandemic. And allow me to begin by first talking about the normal state before the pandemic, where RNAO had advocated and wrote a number of briefing reports on the state of long-term care. I know across my 38-year career that for at least the last 20 to 25 years, RNAO has been sounding the alarm on the state of long-term care and how advancements needed to be made in many fronts, not only with staffing, but in terms of infrastructure, et cetera. And all of that came to the fore during the pandemic. The second thing that I think is critically important that RNAO talked about forever is ensuring that there is a stable and sustainable RN nursing workforce. And this is all about ensuring that in times of crisis that we have an appropriate supply of skilled professionals to be able to expand and use their skills in a flexible manner when these catastrophic events occurred. And in fact, I think one of the most important policy reports that RNAO ever wrote was Mind the Safety Gap. And it's also an important work for me because, as Doris mentioned previously, that is the policy paper that RNAO work that I wrote, that I spoke to, that led to my termination from London Health Sciences Centre. And when I reflect back now on that work, the work was so impressive that it actually scared many healthcare administrators, and I think it still does, because the discussion about replacing RN in the system as simply a consequence of finance is not one that healthcare administrators, governments, anyone wants to have. But it is something that we need to continue to talk about. So the Mind the Gap report is the second piece that I think is clearly reflective of some of the challenges that we had during the pandemic. The third thing is that we have known for years that supply shortage of registered nurses in critical care areas, ED, PACU, OR, ICU, have existed. And yet, we have not, as a system, moved to a place where, again, that supply care infrastructure in the system has been bolstered enough to withstand a pandemic or a catastrophic event. So those are the things I think about if I think about returning to a normal state, and that's not where I believe we're going to return, nor should we return. And the reason is because I think that the pandemic really validated and strengthened all that RNAO has been saying for years, that at the core of our healthcare system are registered nurses. And it is not that every single healthcare provider, whether regulated or not, every single physician did not come to the fore during this pandemic. They certainly did. But I know as a healthcare leader in the system at the time, as a chief nurse executive, that many of the strategies that were built in the system to sustain us through the pandemic were as a result of a lack of RN supply. It was the RN skill mix, the need to be able to have that flexible level of in depth and breadth of knowledge, and to be able to expand that to account for all of the needs in the system during the pandemic. That is where all the energy was focused, to expand that RN workforce. So when we think about it now more than ever, this is a point in time where that advocacy that RNAO has taken throughout the years, and those facts that we relied on so heavily over the years about the RN shortage in Ontario and otherwise, has now been clearly articulated through the pandemic, which is a very positive thing for us. You know, I think that our profession and what it's going to look like after the pandemic, it also cannot become a new norm based on some of the modifications that were required to be made during the pandemic. You know, as I spoke about, based on the fact that RNs in the system needed to build new roles and expanded roles and new ways of delivering care, but that is not a new norm that we can consider for the future. When you think about times where we are in a catastrophic event, there's generally two strategies. One is to expand your resources so that you can continue to care with the capacity of people that need care. The other is to triage people into categorically those that will not survive, and to continue with your existing resources and accept the fact that some people will not receive care and will die. I don't think that's the kind of system that we want to build after the pandemic, nor is that an acceptable system to build. So my bottom line take of what will happen after the pandemic is that we will be stronger, more powerful than ever, that the advocacy, the policy pieces that RNAO has developed, that we have all contributed to as an RNAO family, will in fact gain us the traction that is required to finally set our healthcare system straight, to ensure that registered nurses in the system are placed accordingly, based on need, based on supply, so that when catastrophic events occur, that we do have the capacity to ensure that everyone is cared for and nobody is left behind.
Thank you so very much, Dr. Burkowski. And as you may all know, she was past president. Well, she's past president of RNAO. Now, if I need to remember the year, it's like 4 years ago. Before you, Morgan? No, before. I will get it in a minute. I will give the exact years, but you probably remember, Vanessa. And if not, it's in the bio on the website. Here you go. Okay. Actually, I do remember 2012, of course, or something like that, because that's when 2016.
2016.
Here you go. I got it. Third try, 2016. Okay. We are now going to move to the next phase. And I also want Raul to put, or Ifra to put, the Twitter challenge, please, before we even go into the cloud, the Twitter challenge, so that everybody can tweet using the tag along RNAO, any of the panelists, if you're interested, tag them also, because they will give you legs and we will all give you legs. Then the hashtag RNAO AGM, hashtag nursing through crisis, and the one that by the end of tomorrow, end of the weekend, tweets the most, whether about this panel or anything, the whole AGM, you can still go and look what happened. The one that tweets the most will get this book. Well, I cannot even show it. Here you go. The nursing through did you hear what I almost say? Nursing through crisis. That's the next book. That's the next book. Is transforming nursing through knowledge. Now we are going to move to the cloud. What you are asked to do on the cloud is to put up to 3 words, and Raul will give you the instructions that reflect what you heard, not sentences, words, any word for what you heard from the panelists, not a specific panelist, although you can think about a specific one. This is for participants, and panelists can put 2 words that reflect what you heard, feelings, words, thoughts that reflect what you heard. So, Raulito, give us instructions.
Yes, absolutely. You can see the link up here. It says menti.com. You can go there and please use the code 32090667, 32090667, and you can start filling in the words. By the way, Doris, here's the book if anybody wants to see it. This is for the Twitter challenge. Anyways, so you
can one click that thing? Because I'm trying to click and I don't
think you can click from there, but you can go to menti.com. There you go. It's happening now.
Oh, it's happening. Okay.
Yes.
Someone is doing it well. That's good.
I don't know if you can see it, but it looks
yes,
beautiful.
It looks. We will give it a few minutes because we want to hear.
Minding the gap, retention, courage, presence, respect, understanding.
Don't read them, let them, otherwise they will repeat them.
Oh, that's right, yeah.
Let them, they will see the whole thing and then we will take a picture and you will tweet it or one of our colleagues will tweet it. We will give it a couple of more minutes. Ifra, tell us 2 more minutes because it's coming and we have a lot of people. We have over 100 people. So we want to make sure that we can join. Raulito, can I ask you a favor? Can you send me the link in a WhatsApp? I'm going to send it to my colleagues in the panel. So
yes, absolutely. I'll send it right away.
Thank you so much. With the code, huh? And the code.
I just sent it to you, Doris. That should
it's ready to go. Okay, I'm sending it to the panelists. We will give it few more seconds and so they can also, because they heard one another. So here you go. I am sending it. Claudette, Morgan, Amek, Ola. I'm sure Ola got it. That's it. Did you get it, guys?
Yes.
Okay, good. Did I miss anyone? Vanessa, you want that? Vanessa probably already got the technology too. Okay. Very good. I think it's stable, or is it still coming, Raul?
There's still a couple of them coming in.
Okay, let's
see.
keep it then. Let's keep it. Let's keep it for a few seconds. Very good. Meanwhile, you know what? Meanwhile is good. Let it in still, Raul. And meanwhile, people that want to make reflections or questions, start to put your hand up in the reaction. You go to reaction and you go to raise the hand. People can still put words in the mincing meter, but people can go now to the reactions, put your hand Ifra and Marian will go first come, first serve. Marian, we will wait a minute until you gather 10 hands. We are not going to answer every single question or reflection. We will simply gather all of them, and then the panelists will, in the final remarks, comment incorporating your questions. Okay, Marianne, our hands coming up. Ifra?
Yeah, we have 3 so far.
Okay, so we will wait a few minutes. Let me repeat the thought. So people that want to make a reflection, either similar, different, your own thoughts about the same question, how will nursing come out of the pandemic, or what does nursing need to do to come out of the pandemic, or you have a question, doesn't matter to which panelist, you can say to which panelist, but all the panelists will take your reflections and questions plus the Mincimeter in the remarks they make at the end. And we will start, just so she gets prepared, with Vanessa Burkowski. We will go the other way around, and we will end with Ola, and Ola will tell us, reflecting on what everybody's saying. Ola, this is a big task, of how does her heart and mind feel as a graduating nurse after she hears what everyone is saying, what everyone has reflected, and what everybody is asking. And are we good, or should we give it more time? How many hands you have?
Doris, so far we've got 5, but we are being asked to repeat the question.
Very good. I will repeat the question. So it's not a question, it's the question, the original question, remember, is the question of the panel, is what will nursing look like coming out of this pandemic? But you can interpret it as what should nursing look like? You can interpret it as your thoughts of what nursing challenges are or opportunities. It's your turn. So your turn to spin the question in whichever way you want, related, of course, to nursing and the pandemic. And then panelists will incorporate into what their remarks are. The aspects, some may answer directly to you, some may not. You go for it. We want to hear from you. It's your turn. We have over 100 people. We have 7 esteemed panelists. They each spoke eloquently. Now it's your turn. Of the other 90 people, well, 89. How many hands we have?
Doris, we have 6 people waiting.
So I think we will let them now go to start. Just first, Raul, take a picture, and Victoria, or you, Marianne, take a picture of the Mincimeter. We can keep probably the Mincimeter on in case people want to say more words as they hear. What do you
Absolutely,
think?
absolutely. I'm going to repeat it again just in case anybody didn't get it. If you go to menti.com in your browser, or even in your phone, when you check your internet, you can go to menti.com, and you can put the code, it's in here, 32090667, and
go slower with the number. Go slower with the number.
Oh, yes. The code is 32090667, and you can put it's your turn to use a word to describe what you have experienced today.
Okay, Marianne. So we will keep the Mincimeter. Meanwhile, Marianne, you can let people, Ifra will promote them to panelists, and people can, 1 minute, Ifra, be strict, because if not, we will not get through it. Please.
Okay, our first participant who would like to speak or give a comment is Lorna Edwards.
And in the go forward, just the name, IFRA elevates to panelist and the person goes for a minute, and IFRA, you cut the mic at the minute. Thank you. You can tell who is the, you know what, Marianne, why don't you read all the names so IFRA will start to put them as they speak.
Okay,
Just
we have Lorna Edwards and then Elsie Millard.
Lorna, you're unmuted. You can go ahead.
Okay. Good afternoon, everyone. What nursing needs to do to come out of this pandemic? Firstly, I believe the researches that has been done on nursing in terms of the COVID, I think we should find what the results are. How is it that people who have had the vaccine, how did they fare? And those who didn't, how did they fare? We need to know that first for Ontario. And I believe it has a lot of opportunities now for nursing, because now those who have retired or those who are at the end of doing nursing, they would be able to now lead as mentors for nurses who are currently in the system. It should be an opportunity where we have a chance to promote the understanding and have that advocacy, because everyone needs hope. And we have had passion, and we will speak the truth because we are committed in giving the best of what nursing provides to our communities. And we will give the respect and the support that's necessary, because we do have evidences in our communities, and this will make nursing an amazing profession as we move forward.
Thank you, Lorna. So next we'll go to Elsie. Go ahead, Elsie.
Well, I want to thank all the panelists for what they've said. And I keep hearing the words opportunity, and I think that's very hopeful. And so I would like to hear a little more about what the opportunities are and how we as nurses around the province can support those opportunities and advocate for them. So that's what I'd like. Thank you.
Thank you. And then I saw Deborah Lefebvre had her hand up. Go ahead. You can unmute yourself.
Hi there, it's Deb Lefebvre. Thank you so much for the opportunity to share my thoughts. When I think about and what all the panelists have said, for me, I see strength moving forward within the nursing profession. Originally, at the start of the pandemic, there was great hesitancy and reluctance for nurses to stand up and speak out. And I've witnessed a growing awareness, and largely due to RNAO and its leadership and many of the webinars that gave nurses more voice and gave them confidence to speak out. And I've noticed even within my own workplace, nurses are sharing their thoughts, their views, their opinions, responding to emails and outlining their concerns, which, as we know, nurses need to lead nurses, and nurses' voices need to be heard to improve the systems in which we work. And yesterday at the AGM, I was so pleased that Doris held Premier Ford's feet to the fire and talked about Bill 124, but also raised the issue of the chief nursing officer. And so this speaks to Amek's comments about, nurses leading nurses on the panel just now, and also having a nurse, having a chief nursing officer, and hopefully, as Doris hinted at, as an associate deputy minister, perhaps in health. I don't know. I just about jumped out of my chair when I heard that. But Morgan's comments about being positive in the workplace, it's so easy to slip into negativity, isn't it? And it's so easy to dwell in all of that. But nursing, we've all gone into nursing with a view to help others. And there are so many positive aspects to delivering quality, safe patient care. And so all of the panelists, Ola, every one of you, thank you so much for your reflections and for your comments. But again, I go back to the word strength. Thank you so much.
Thank you. We'll go to Margarita next. Go ahead, Margarita. You can go ahead and unmute yourself.
Hello. I just have a couple of things in regards to getting out of this pandemic, which is that we have to ensure that the government is not minimizing measures such as we have to bring back the vax mandates, the mask mandates, and to normalize things like that, as well as the proper 10-day isolation and whatnot. So that needs to be done. And also in this whole paradigm of getting out of it is to do the proper tracing and testing of people at all times, because we don't know if that next variant going to be the Ontario one that's going to be so bad that it goes undetected till the hospitals are in shambles, which they already are. And so it's that transparency to know what numbers are, to be unpolitical, and that we have to fight for healthcare at all costs, irregardless of who is in charge, because honestly, the way that things are going with the Ford government, it isn't going to be so great moving forward. And I'm already hearing of a lot of elderly who used to have medications and tests covered. They no longer are. One case where a lady is paying almost one full pension payment within the span of the whole year, and that's not right. We need to ensure that these retired and elderly are getting the care as well as everyone else, because I have grave concerns for this fall, and especially since there is the waning ability in the vaccinations and how, people have gone back to 2019 normal when we shouldn't be. We should be making a new normal that's going to be making us normal and moving forward. Thank you so much.
Thank you, Margarita. So we'll go to our last member, Burton Mohan. Go ahead.
Hello, thank you for the question. Sorry, I'll lower my hand now. I know the word mentorship came up, and since we have many nurse leaders here, I wanted to kind of beseech you to think about how you present yourself and if you are presenting yourself as a mentor, because the organizations that I've worked at, I've tried to reach out to mentors, but many of the nurses in leadership positions are managers and higher, like chief nursing officers, and they don't actively take part in mentorship, even when you reach out to them. And there is an idea in nursing that's very ugly of nurses eat their young. So if we want to do away with that idea, I would beseech you to take on mentorship opportunities. They don't take a lot of time. They can be as quick as a 5-minute conversation every 2 weeks. So that's just an idea that I want to put out there. I'm someone who's relatively early in their nursing profession. I think I'm entering my 4th year. So thank you.
Doris and Ifra, it's Mary, and I don't know if we have time, but there are 2 comments that were put into the question and
read
answer.
them very quickly but really quickly, because we are stretched on time.
Yeah.
You know what, Mary Ann? No. We will keep going, please.
Okay. Yeah.
I just want to be respectful of the process. And then if we have time, we can read them. We have a lot of panelists, and I absolutely want to give the proper time to Elder Perry Shobogajic to bring the blessings and the closing remarks in a way that only he can do in a good way. Thank you so very much. So I will pass the baton to Madam Vanessa, please, to bring from what you heard, from what people wrote, your thoughts, your closing thoughts on this.
Thank you.
3 minutes.
2 minutes, yes, thank you, Doris. So,
Three.
3 minutes, okay. So I absolutely believe that nursing in the future is going to be stronger, it's going to be more vibrant, and it's going to be more impassioned than ever to make a positive difference in healthcare and to support some of the key policy issues that RNAO has advocated for years. In terms of opportunities, it is our opportunity, all of us, our opportunity as part of the RNAO family to contribute now, because that's now, especially is when it's needed, whether it is in terms of bringing on your colleagues who are not familiar with RNAO, having them become a member so that our voice grows and goes from strength to strength. I love the idea of, as we're all leaders in nursing, we do need to mentor and support each other. I love the idea, and I always have in my own career, and I encourage others, even when I was chief nurse in the hospital, when I was chief nurse in the province, I always had students, I always mentored people. And I think that that is critically important. And now, especially is the time to do it when you have a group of professionals who are really coming out of some tough times, and you want to inspire them to move forward and lead others into the future. So for me, it is all positive, because now, if any time there is now to recognize the need for nurses, for our association to move forward on all of our advocacy issues, it's now. So engage. Thank you.
Very, very much. And we are going to move from Vanessa to Dr. Holloway. Please take it over.
Thank you. And I just want to speak to Ola and encourage you to continue to move forward. As I think they call me now a late career nurse. I am here for you, and so are many others, and so are the younger set. We need to work together. In addition to all the things that I do on a volunteer basis, I've always tried to coach and mentor informally outside. And I find that it helps me to grow. So I encourage everyone to do their part in mentoring. In terms of this last piece of the event here, I thought of 3 things. Let's build up. Let us speak up. And I think that we can show up. So let us build up each other, support each other. When someone is down, let's help pick them up, so that when I'm down, you can help pick me up in a variety of ways. Let's work together as frontline and management. We each have a role to do. Let us respect the roles that each other have. There's diversity that is increasingly growing. There's strength there. So let us really bring our allies in a strong place to help move this forward. Let us show up because we need to speak the nursing profession that we want to have. And I know there's, as we say, there's a lot of frustration and negativity, but as I was told years ago, you know, bad news sells newspapers. But you know what? We have a good news story to tell. We have a calling, as Mick said, you know, we can work together. So we know that it's not going to be easy. I'm here to do my part. I strongly recommend that we continue to spread the word for RNAO to get others to join, because we are a recognized force that can speak to our government so that we can advocate for the things that we want, that brings respect, value, and better healthcare to Ontarians. Thank you.
Thank you so much, Madam President. We are going to move from you to Morgan Offord, our immediate past president. Thank you, Morgan. Take it on.
Thank you. It was so great to hear from all the panelists and to see the Menti cloud and all of the really inspiring words about what the future of nursing will look like post-pandemic, and to hear the comments and the feedback from our participants as well. I think when we think about what the opportunities are, I agree with what Amik said earlier. We need more nurses in leadership positions, and I think being able to support nurses that are even early in their career to think about leadership, to help them to develop the skills that they need to be successful in a leadership position and to support them through that is really important. Whether it's leadership in hospital, in community, in politics, in public health, really making sure that we are supporting people who and nurses who want to be leaders to build the skills that they need to be successful in those positions, and to build kind of the courage and the persistence and the grit that they need to work in those positions. It's not always easy. It's not always rewarding, but there is a lot of opportunity to make a significant difference. I used to say when I worked on the inpatient medicine unit, one day when I'm CEO, here's what I would do. Sorry, I'm losing my microphone here. And I mean, although I don't always have CEO aspirations, I think it's important that we kind of dream big about what tables nurses should be at and deserve to be at. And really making sure that we're supporting a diverse group of nurses to be able to be at those tables. I also think I like Deb's comment about positivity. I am one who can get into sometimes the toxic positivity. I know that it's not always positive all of the time. And I think that's something that I personally need to be mindful of, that I'm not always trying to find the positive, because sometimes there isn't one. But oftentimes there is, and I like celebrating things that actually are positive. And I think if this is the right Burton that I'm remembering, I couldn't see what you look like. I remember when you came on a student board of directors placement, and I think it's a point well taken to make sure that those of us that are, as I said early in the panel, now that I'm a mid-career nurse, making sure that we are presenting ourselves as mentors and really being open to those mentorship opportunities, whether it's a formal mentorship program or an informal program, to make sure that nurses who are in leadership positions are helping those who are aspiring to leadership positions. I do think the future of nursing is bright. I think we have a range of nurses here on our panel who all have various experiences and all can still speak to, maybe what wasn't so great, but also the things that are happening that are demonstrating that nurses are making a huge difference in our healthcare system and to the people and populations that we serve.
Excellent. Thank you. Thank you very much, Morgan. We are moving from you to May.
Okay, a couple of minutes to say something that's probably, when you look at the constraints that we have in northern remote communities, physician shortage really impacts what a nurse can do in the communities. So if we could look at something like what are the tools that we need as nurses, continuing to expand the scope for nurse practitioners and RNs. And I know it's not popular, but I truly believe that in northern remote communities, RN prescribing can really help the care, the timely care and the quality care that First Nations receive by the nurses who work in the nursing stations. I was told before when I was advocating for RN prescribing that we already have RNs that prescribe and they're called nurse practitioners, and I don't buy that. I think it's an elitist way of looking at our scope of practice and what we can learn as nurses and the skills that we can bring to people. We have a lot of catch up for primary care. We've had people who've missed screening for 27 months, and we are finding people in end stage cancer now. So stage 4 being identified for the first time and not very positive. So we need a lot of help in our communities. And for those who feel like they're burning out and want to quit the profession, don't do that. This is a lull. We're all feeling it, but I think in some ways if you want to change, we have beautiful locations in the north. We have great colleagues and community members who can certainly work with you to deliver your nursing care. The fellow who wanted the mentorship, phone me, 807-626-6254. I mentor anyone who wants to ask questions about the north. I want to say hello to Matthew Kelway and Daniel at RNAO this morning, and Poonen, as well as Kathy Crow. So, don't forget, we live up here. We love our location. We live in the north for a reason, and we'd love to share that with you. So, miigwech.
Miigwech, thank you very much, May. And now we are moving to Emek.
Thank you so much.
Your mic, Emek, is not, you're breaking.
The first thought that comes to my mind is just comes to the North remembers. And is it better now?
It's a bit better, but you're still breaking.
Okay, let me just turn off the video. Maybe that might help. So the first thing that comes into mind is for me is the North remembers. As May just finished talking, and we need to bridge the gap between Northern Ontarians and Southern Ontarians, and that divide has been very profound. And innovation in the profession has come from Northern nursing, has come from the extended scope of kudos need to be given where they're due. I think the profession stands right now is at a turning point. It's a ripple effect that's happening, and it's happening in our local chapters. It's happening in our lunchrooms. It's happening in our locals. That ripple effect, that change, and this pandemic has shown us that we need change, and the way to quantify that is in your own ability to practice your agency. So I hear lovely conversations about leadership positions on high levels, but what about your local? What about your lunchrooms? When was the last time you had a conversation about union challenges or issues that you should bring forward to the union? That was fun. It was just not a long drawn out meeting. You guys had fun with each other. It was a team building moment. I think that culture needs to come back. We are bearing too much and not speaking enough in safe spaces. So our meetings, our RNAO meetings, our mentors are always there. They're a phone call away, they're an email away. They always have been. And we need to build that capacity and control and continue to build that capacity to show each other that we can be supportive of each other and continue to grow the profession that way. And I would welcome that. There are mentors that need to feel acknowledged for holding the profession for such a long time to the standards that we all care deeply about. That is what's needed at this time. And I think we're at a good moment to be reflective and go out there and do the action that we need. So grab a cup of coffee with your fellow nurse, go and talk to them and say, hey, what is happening? Young nurses, talk to the nurses that are veterans in the field and see what are the challenges that you've seen? Am I experiencing the same thing? So if it's a systemic thing, it can be flagged from two different colleagues in a way that might be more conducive to action. We're at a change moment time. And I think that is the only beauty out of COVID that we got out is that the respect for the profession, the understanding of how frail nursing human resources are in the province are understood. But now is quantifiable change. So whatever it means to you in your practice, whether it's intensity of more presence in Northern nursing, whether it's more capacity building in our hospitals, whether it's community-centered care in your public health units and community nursing, whatever your challenges are, if they're systemic, have a ripple effect, which will make a huge wave, and it will be a positive wave for the entire profession.
Thank you so much, Ame. And now we are going to move to Carla.
Hello again. I am really inspired with what everyone has
Carla,
shared.
I cannot, is your camera off in purpose?
Oh, it's acting up. It has been acting up the whole time. I'm sorry.
No worries, go for it.
Okay, so I am really inspired with what everyone has shared, their reflections. This enlightened me and make me look more on a positive perspective. I am very hopeful that issues will be addressed and that change is going to happen, because nursing is it's a very rewarding profession. I do not want to come to a point where I would want to leave the profession that I worked so hard to get. As a new nurse, I am looking forward to working with many mentors that can be great resource persons. I really agree that we can benefit from great mentors to gain skills, support to become more successful in our field. I am looking forward to the day where I can also become a great nurse, I can become a leader, and I can also become a mentor to new nurses. So that way, when we have more nurses, we can all continue to save the world, one patient at a time. Thank you.
Thank you so very much, Carla. And Carla, I need to make a correction. You are already a leader. You were a leader even before you were working. You were a leader. I mean it. I need to say this, guys, because not everybody knows, but we at RNAO know. You were a leader before you even approached us. You organized the IENs. That is leadership. So, yes, thank you. Ola, how does this future world look? How are your shoulders feeling? How is your heart feeling? What are you going to tell? What are you going to tell your colleagues when you go to work on tomorrow or Monday, or friends or colleagues in nursing, or people that are telling you, I want to be a nurse? What are you going to tell? Because let me say this, there is 35% increase in applications to the baccalaureate program, 35% increase. There is a colleague during the event today that said mentorship. So Ola, what are you going to tell to all these 35% that are waiting to be accepted or not, and the many others?
Okay. Before I begin, I want to give a shout out to Kathy Crow. Oh my God, I'm one of your biggest fans. I learned about you in my community class and the work you've done with homelessness. It's really an honor to see you here, watch me speak, and I hope that you do remember my face. And in response to Dr. Doris's question, if I say I'm not a little bit terrified, then you know I would be lying, because I'm a clinical extern in the emergency department, and I'm telling you, almost every day they are short of nurses. Nurses don't go on break. And I will tell you, as a clinical extern, I never believed I would work without going on my break. And I'm not even a nurse yet, but I couldn't go on my break because we had several codes after codes. And guess what? As a clinical extern, you have to help, right? And it is really scary to see that this is what come October, that I'll be part of this, but it doesn't shake me off, because at the end of the day, one of my professors said to us one time, you choose nursing. Nursing did not choose you. You chose it. And at some point, it becomes a lifestyle for you, right? It becomes a part of me, and that actually gives me hope. Morgan said, dream big. And yes, that is what I will always do. And that is what I would tell my mates, dream big, right? We have support, we have mentorship, we have leaders we can look up to, and they're very courageous and resilient. they continue to advocate for the profession, and they continue to advocate for us. And that is what we should learn to do. And we should dream big. Just like me, one day I want to be a nurse practitioner. And just like Claudette, one day I want to have my PhD. So I will have all of them and I will do my job pretty well. And that is what I want to say again with nursing, this continuous learning, this lived experiences. At the end of the day, it's fulfillment. It ties back to my passion for nursing, and I'm just being very hopeful. And that's all I have to say. Thank you.
Thank you so very much, Ola, and that is indeed very hopeful. So I'm asking Raul to put the Mentimeter again. And this time we are going to, you can either choose words or you can choose a number. So how do you feel after you heard all the closing remarks? Then you can choose words, or how you feel in a scale of 0 to 10, 0 being hopeless. I think there is no future for this profession, it's closing down. To 10, I am filled of hope that we will come out stronger out of this big mess that was the last 2.5 years. But if I go to Vanessa's comments, and she was right, we have been pushing for some of these issues since ever. So put the Mentimeter again. Oh, here you go. People are going already. Beautiful.
So once again, they can go to menti.com and use there's a different code now, 57287709. And,
but they already
yes.
are going on this one, Raulito.
Oh,
They're
yeah.
the same. Leave it the same.
Okay. I sent you the link.
Because look, they're already putting stuff.
Absolutely.
Okay, so we use the same. Meanwhile, that people are putting their words, and not to steal time from Elder Perry, I don't want to put words into the Mentimeter, but I'm going to make a few comments about the comments. First of all, May, I need to tell you that in the remarks of the Premier yesterday, I think it was yesterday, I'm losing track of the time when everything happened, he did speak about iron prescribing. And it's not something that I ask, because I've been asking that, as you know, we have been asking at RNAO since 2012, but he did mention about prescribing. So the message is getting. I also want to thank Deborah Lefebvre, for commenting on my comments back to the Premier about the bill, and also about the chief nurse. And yes, I think RNAO will get its way, and it will be an associate deputy minister. And if not, we will continue to knock the doors, but I believe we will. And third, I want to say one other aspect that I did ask the Premier, and I'm intent on that on behalf of RNAO and all of us, is the issue of the opioid pandemic, the opioid crisis. So those are the pieces that I mentioned. And I don't know if you saw some of the tweets. Some tweets were pretty nasty. Some tweets were very inspiring, answering to some of the other tweets. Social media is a very interesting phenomena, and I don't go often, but I am alerted to those. And one person answered to one of those tweets, yes, but we have a relationship and we need to have it. Because without relationships, whether it's amongst ourselves to start with, as many of you mentioned, amongst us and all political parties, including the government that is elected, and amongst us and the media. And it's so awesome to see so many members speaking with the media, and among us and ourselves. I think that's one piece that perhaps we didn't reflect enough today about. It starts with us. Of course, we need to be with the rest of the world and push the rest of the world and inform and encourage. But I think Morgan reflected that a bit in her remarks, and Claudette, it starts with us. It starts with us, how we want to frame the world, despite that sometimes the world is completely ugly. And it starts with us, how we want to respond to comments. And sometimes some of those comments come of the most progressive and the most important people that I know, and sometimes even then they're not appropriate. Whether a person has a 12-year education to become MPP, my gosh, just imagine if people that don't have the possibilities to get education would never run for politics. So sometimes I get surprised just by ourselves, people that I love. And sometimes it comes from the outside world. It starts with us and then it goes all the way to systemic changes that we need to make. So I see here that people are saying hopeful, encouraged, inspired. I see number 10 is big. So you know when the words are big, it means that more people answer. That's all that it means. Someone took the time to put 10, 10, 10, 10, 10, 10, 10. That looks like a new radio station. So whoever put that, go for it. We do have future also for people to be involved in media, not just speaking, but actually in creating media, like our colleague Amek. To each of the panelists, starting with Vanessa, that needed to leave the meeting, but I will let her know. Just inspiring. I always say, Vanessa, and many of you, wear RNAO in your sleeves. Wear RNAO in your sleeves. I mean, Vanessa was president in 2016, and she remembers the report. She remembers, you know, she has a deep value for the policy and advocacy work of RNAO. And then, of course, moving to our president, that gives us the importance of presence, the importance of togetherness, the importance of recognizing what needs to improve, and also that together we can do it. To Morgan, and Morgan is the 3/4 full of the cup always. Actually, I would say she's like the 90% full of the cup always. But you know what? It's not just words, it's walking the talk. I know how many shifts Morgan did at night. I know how many shifts he did on the weekend. I know the type of workplace that she and her colleagues are creating. And Morgan, yes, dream big, because I know you will achieve those big dreams and you deserve to achieve them, and the profession will gain from it. And then from Morgan, we are going to May. And all I can say, May, my gosh, I'm so happy that I met you a gazillion years ago, and that you are such a mentor, such a compassionate and such a inspiring mentor, and that you do insist on us people like look like me and others learning more and more and more about indigenous wise practices and the language. And I just, every time I speak with you, and I know what you do in your day-to-day work, you simply inspire. You inspire and you marvel. So Chimiwich, forever, forever, forever. Thank you. And yes, if people want to do a good placement with a nurse practitioner in a indigenous community, go with May. You couldn't have it any better. And of course, from May, we're going to AMEC. And yes, AMEC in those, it's not only in the boardrooms, it's in the lunchrooms, and it's with the union, and it's with RNAO. RNAO is involved, ONA is involved, many other organizations are involved. Every single nurse in whichever forum needs to get involved and needs to have a say in decision making. And thank you for what you do, Amek, and for speaking out both at work and in the radio. And from Amek, we are going to Carla, I believe. I'm going by memory, so here you go. Carla, you are a leader. You were a leader, you are a leader, and you will be a big leader. And what people don't know, and Morgan does, because I think I mentioned that to her, that Carla is another colleague that chose long-term care. Carla Ducasin had 5 offers, and I'm well aware because I was a reference. 5 offers once finally she got her papers. And she chose, and the 5 offers were, by the way, Morgan, all from long-term care, because that's where she wanted to be. And she made her decision in the way that she needed to make it. And your future, Carla, is absolutely super, super, super bright. No doubt about that. No doubt about that. And then from Carla, we are going to Ola. Ola, I'm just going to be watching where you, not only where you go, but where you take us, where you take the profession, because you have many years from you. But I will hold you to account, even 20 years from now, if I'm still in this world. You promise that you love this profession and you're not going to leave us. I just want to know where you will take us, because I think you will take us places alongside with all the colleagues of your generation. Yesterday, I was absolutely privileged, and many of you were, to attend the meeting of the NSO. Oh my gosh. The way they spoke, the way they prepared for that meeting, from what they said to the slides, to the content, to the delivery, to what they have in mind. I know we are in good hands. I know we are in good hands. Did I miss any panelists? Because if I did, I will be mortified. I hope I didn't. I went by memory. I said at the beginning when I was, when we were having a meeting 5 minutes before we opened to you guys, I said to my colleagues, no Alzheimer. I remember all the order, so here you go. This is good. You guys are fantastic. And with this, I want to ask Ifra, do we have Elder Perry here? Because I would like to introduce him. Raulito, you want to take a picture, or Marian? And Marian and Ifra and Raul, and of course, all the panelists. Thank you so, so, so very much for participating, for letting your courage be picked to speak, and for the words of wisdom and the reflections, and to all the people that left reflections in the chat we are capturing, and that make comments, reflections, questions, and all of you for a tremendous participation. Ifra, is Elder Perry here?
Elder Perry hasn't joined us yet, but why don't we take some time now to take a photo? And Victoria.
Oh, lovely. Yep. But we will want one with him after again, eh?
Yes, definitely.
I think it would be nice to get a photo of the panel members, all the panel members.
You will need to Photoshop Vanessa. And then after the panel members, Marian, we can do of everybody that is willing to put their cameras on.
Yep, Victoria and I have taken photos, but she's taken most of them, and she can do the panel right now while we're waiting.
Fantastic.
One, smile. All right, 1, 2, 3.
Do we want hearts?
Let's take one with hearts and one without.
Okay.
And then Victoria, you let us know, and then we can they can set their hearts in motion because they're on the timer.
All right.
Well, my hearts fly for some reason. They don't go in the screen, which is just fine.
No worries. Okay, I'll take one with the hearts flying up. Perfect. Thank you.
Thank you, Victoria. Thank you for being with us today on a Saturday. Much appreciated. Do people want to put the cameras on, please? I mean, everyone. everyone, so we can take a picture of 86 people that are still with us. Can we promote them, Ifra, please? Or do they need to do just to unblock everybody? Are we having people joining? I cannot see. Yes? No? Yes, I can see a yes. Let us know, Victoria, when you're ready, please.
Perfect. Okay, I will take it now.
Okay.
All right, everyone, smile. Perfect. Thank you all.
Thank you, Victoria. I see the Pride flag, so I hope many of you will join us for the Pride Parade. We will be there with the RNAO banner. Connect with either Marian or Matt or me or Michelle Rangel, anyone that you know at RNAO. If you are planning to come, please let us know so that we can tell you where we will be as they locate us, please. Thank you so very much. Ifra, you are directing the traffic. Is Elder Perry with us? Ifra?
It doesn't look like we have Elder Perry with us. Let me just do a quick check.
Do you have his phone number, please?
Yeah, I'm just going to give him a call.
Fantastic. Thank you so much.
Not to put you on the spot, Carla, but while we wait, will you tell us a bit about did you do the supervised practice experience program in Ontario? And if you did, what was it like for you?
Hi, I did not do it. I did not do this. Yeah, I went straight to taking the boards. Yes, but I am currently working in the Veteran Center in Sunnybrook. And it's really a wonderful experience. I've been learning a lot and I like the job. I like speaking with the older people. I like working with the nurses there. It's an amazing experience.
So Carla is an experienced spokesperson on anything to do with IN in the media. What happened with Carla? You want to share, Carla, what happened? That email at 2 a.m. or whatever.
Oh.
And then from there on, what you were going through, and not just you, the 26 colleagues, right?
So we tried to make a Twitter barrage one one night, and a colleague of mine tagged, I think, Dr. Doris Greenspan about our situation, because we are caregivers who have been waiting for our permanent residency. That was the only thing that we have been waiting for, us to be licensed as RNs here in Ontario. So we were so desperate at that time that we just thought the last resort was make a noise in social media. So we reached out to RNAO, and they have helped us tremendously. We met Dr. Greenspan in January, and March I got my permanent residency. April I started working as an RN. So everything, it was a roller coaster of emotions, but it was an amazing experience. 8 of those 26 have already gotten their permanent residencies, and all of them are now working as RNs, RPNs. And also, I think 3 got open work permits. Some are still waiting for their papers to be processed, but we are very hopeful that they will get theirs and they can start working. And I'm also hopeful for other IENs that they can also start working soon.
So there is different issues with IENs, right? There is the great majority that apply to the college and takes longer than when it should to have their credentials validated. Then there is a group, and Carla was on that group, and Carla organized that group, I will say it again and again, that they came as nannies, most of them, or caregivers for older persons, and they were nurses in their countries also. And it's an issue then of moving the papers from the permit to be a nanny to a permit to work in something else called nursing, because it's different. So I was actually working on something, and I got a message, aside from the tweet that I hadn't seen, a direct message from a colleague of Carla. And given that I got that message, I answered to her, do you want to talk? Like if she's sending me a message at 2 a.m., I answered at 2 a.m. and we had a chat. And then Carla is the one that organized everything. All I did is open doors with the Prime Minister office. But they did all the organization. They were like that every time that something was needed. And that's why I say, Carla, you are a leader. You want to be a leader? Yeah, you can be a different, whatever role of leader, you are a leader. You are a leader. When I spoke, as you know, and I can say it because she has spoken publicly, you were a leader when you were taking care of that elder person at home. They loved you to n degree and help you to achieve what you have achieved. You were a leader when you were on the television with Natasha Fata. You are a leader in your workplace, and I know you will be a leader in your workplace. And the fact that you are in long-term care, I think, gives to people like Morgan and many of us that believe that long-term care is not valued at the level that it should and ought to be. So you give us a lot of hope, same as yesterday evening, the colleagues, young generation colleagues that Lali is graduating, others have 1 more year. Orola, you know, you guys need to take it on, run with it. How are we doing, Kifra?
We do have some questions if we want to look at that while we wait for Elder Perry.
Okay, sure, you can put them on by all means.
Sure. So Marion, why don't you read some of these out, and then we can also ask attendees if you want to raise your hand to be recognized for a question.
Yeah. I actually, I have a request from someone just to put the Twitter info on the screen while they're waiting. So we have an active Twitter person who wants that info. So if we could put that on the screen, that would be great. I do not have any other questions, Ifra, just so we're aware.
while we wait for Elder Perry, is there any other questions that people had or comments that people wanted to make? I think people have the ability to raise their hand if there's something they want to ask or something that a comment they have. I see your hand, May.
Yeah, I can't find it on my, so I have a comment about public health system. So as you know, we do not have public health units in our north. We do have urban, I guess their offices across the north. So during the pandemic, we were dealing with 5 public health units to be able to manage some of the guidance that we were receiving. They never came onto into our communities, which was really hard to do public health without a public health system. So we created our own. We filled gaps by asking for 50 public health nurses to work in our organizations, and we were able to obtain the funding for that, and really thank the work of Matthew Calloway and Doris to advocate for that. But that's running out September 30th. They're saying, you know, pandemic's over, you don't need 50 public health nurses anymore. And we totally disagree with that. As we had big gaps, these nurses filled some of those gaps, but you can't just go back to pre-pandemic states, which is, I think, what you said, Morgan. You know, and it's really hard to advocate when you're up here. I mean, we're not in Toronto, we're not in Queen's Park. We do not have 5 million people to support us. So that's, you know, the forgotten, you know, location in many policymakers' minds, even in, you know, nurses, especially if you're from another country, you don't know where we live, and you don't know we're up here. But we would really like, you know, to have that awareness of the North needs care as well. And, you know, I think in some ways it's, we're not too far removed from what you guys do in the cities. We do have internet. I mean, you know, there's a lot of things that we do that you can't do, which is go fishing and you know, do lots of things like skiing and outdoor, where you don't have to pay a membership fee. You just put your skis on and away you go. But I think there's a lot of misunderstanding about Northern nursing. And I think as an organization, you know, I think we should promote that. So that's my comment. I'm not recruiting because I don't hire, but I think in some ways I am, you know, certainly advocating for how beautiful Ontario is, but you know, in the North, we're even more beautiful. So thank you.
I see Helen toned.
Okay, I am sorry, guys. Not very good news. So Elder Perry Chobogazek cannot join. Somehow his connection is not working. He says he's out of range. I know that he would have done a magnificent way. I even had learned on what his name means and was going to share it. And I think I'm sorry that that closing cannot happen. So I don't know if you, Madam President Claudette, want to bring a few remarks, or I can bring a few remarks, or I just, I'm sorry, guys, that we don't have Elder Perry to do the closing as planned.
Yes, thank you for the opportunity, Doris. I am just pulling up some notes I had from, and with May's permission, maybe she can help us expand on it, but I'm just going to pull up the 7 grandfather teachings that we can take those forward with us. Humility, which is represented by the wolf. Courage, which is represented by the bear, and we heard so much about courage today. honesty, which is represented by the raven. And as we go forward in honesty to speak on health and nursing, may that be with us. Then there's wisdom, represented by the beaver. And we certainly need wisdom in all we do, and continue to grow our wisdom by listening to each other. And then there's truth, and the turtle represents that. And we know about the hurts that have been experienced by our Indigenous brothers and sisters, and we really want to have truth and reconciliation with action now. And then there is respect, represented by the buffalo. And we need to respect each other, and we need to start it now. For those of us that have kind of put it by the wayside, let us bring it forward in everything that we do. And finally, there is love, represented by the eagle. And love helps us to forgive each other as we move forward and as we learn and as we grow. And hopefully, May, with respect to you and your peoples, this is appropriate today, and that I'm asking you if you want to add on to this. Thank you.
I guess the only thing that I would add is that in our culture, our first teaching is kindness. And if you look at what we do as nursing, that's what drives us. That's what drives us to be so relational and to respect each other. And yeah, sure, we're tired and burnt out, but people don't see that. So, you know, that's who we are as nurses. And you know, one of the reasons why I like to be so involved with RNAO. It's a great place to push policy, and it's a great place to meet people. So thank you for that, Dr. Holloway.
And I want to use the new word that May taught us today, Minuanukiman, that today Elder Perry could not reach us because of connectivity problems. And Madam President Claudette Holloway, Minuanukiman, working different, you got us to the end of this session with love, as May also said, and with all the teachings in a good way, So may you all be having health and learnings along the way, and may we all of us together make the future brighter. Miigwech to all of you. Chimiigwech.